copy of, this isn't it, but the talking points or the meeting handout over there. Just to give you a quick premise, we do talk a lot about concussions when it has to do with athletes. I think that's something that you guys have all covered quite a bit. There is another group that we want to highlight who might even be more inclined to suffer those kind of injuries, and that would be domestic violence victims. You can see all of our speakers are wearing purple ribbons. It is still Domestic Violence Awareness Month, so that ties into that as well. And this is also just a huge undertaking in partnership. If you look at the groups here, we're talking about the prosecutor's office, medical officials, law enforcement, research, study. It's all coming together for this. So we have a lot of investment, and we think this is a very important thing. And if you go down the list, you will see our speakers. You should have the correct spellings and titles for everybody. All right?
All right. Good morning. I'm Sergeant Mark Higby. I'm with the Mesa Police Department in the Criminal Investigations Unit. The city of Mesa is the third largest city in the state, and on average we have about 200 calls for service that are domestic violence related every week. So as you can see, it's a pretty important issue for us. So when we were approached by the group to participate in the study and learned about how we could improve the quality of police service and assist victims in getting better care for them, we were more than happy and excited to participate in this study. So our officers, our patrol officers specifically, are being trained on how to use a simple device. This device looks something like this, and we could talk to you about it later and show you later, is a screening tool that the patrol officers will have access to for those who may have suffered a concussion. And we will have 45 of these devices rolled out to each of the patrol squads throughout the whole entire city. So the officers, at any time that they respond to a severe domestic violence case, they'll have access to this device. And then that data will be sent to our research partners. We'll also continue to work and follow up with the victims of these serious cases of domestic violence and ensuring that they get to the Family Advocacy Center and meet with our forensic nurses, where they'll have additional tests and things that Erin will actually be able to talk about.
Good morning, my name is Erin Bertino. I'm a forensic nursing supervisor and I work for Honor Health. We were approached about a year ago. I think the county attorney's office kind of got this, the initial group together, and we were asked, are we seeing patients, routinely our patient population consists of sex assault as well as domestic violence and strangulation. And we were asked, are we seeing patients ever that are reporting getting hit in the head, sustaining any kind of head injury? Because as you heard before, when you think of concussions or traumatic brain injuries, you think of football, you think of soccer, you think of sports. You don't think of domestic violence or a sexual assault with a strangulation or physical assault component, and that's the patient population that we are caring for. So immediately our answer was absolutely, we are seeing these kinds of patients, and we would be, ecstatic to work together to provide not only a better screening assessment for these patients, but then also collaborate with other disciplines to provide a better streamlined aftercare in order to get them the healthcare needs that they might need just to improve their quality of life should they sustain long-term injuries. Our unit sees well over 200 patients a month, and it's about 50% sexual assault and 50% domestic violence. So yes, October is Domestic Violence Awareness Month, and that's the focus, but this study and these patients are also going to be, with their consent, are going to be seen if it's a sexual assault as well. It doesn't just apply to a domestic violence situation. If we have a sexual assault that's also reporting some type of head injury, we'll be doing exams or screenings on those patients as well. And kind of how the Family Advocacy Center functions, it's kind of the multidisciplinary team approach where everyone is kind of housed under one roof. And it works really well because you have law enforcement there, you have medical, you have social workers and advocates, that patients can come to one building and get multiple resources and all in one setting, so they don't have to drive or worry about going here for this or go another place for something else. It just really makes it convenient. Maricopa County has done a great job in maintaining that. There are 5 different centers throughout the county that we function out of, that our unit functions out of, where we perform exams at. Every day is completely different, but we're excited to be able to work with Mesa PD and pilot to try to see how many of these patients are we really going to be seeing. How many patients do we see that are reporting, some kind of head injury, and not only providing them with medical care, which is our first goal as nurses, but then also providing them, keeping track of the data for the research aspect, while streamlining their care and getting them to specialists that they'll need for follow-up care and for aftercare. And then Dr. Lipschitz can talk a little bit more about that.
Thank you, Erin. I think we should move some of these microphones. Now back to our regular program. I'm Johnny Lifshitz. I'm an associate professor at the University of Arizona College of Medicine, Phoenix. I'm also a scientist at Phoenix Children's Hospital, the VA here in Phoenix, as well as with the Cactus Foundation. And when you do research, there's three important components. You need a really good question, you need a phenomenal team, and you need the tools to conduct the research behind it. And so Amanda has already introduced the question, which is, to what extent does traumatic brain injury impact the concept of domestic violence and those survivors of domestic violence? To what extent are their cognitive functions, their somatic functions, and their emotional functions disrupted as a result of either hits to their head or their head hitting something? And once that gets under your skin, you go out and gather a team. And so we've been extremely fortunate to have the support of the Maricopa County Attorney's Office, Cactus Foundation, the hospitals, the universities, in particular, Honor Health, and then the Mesa Police Department. And with that team, we've been working for about a year now to put together this pilot program and all the details that are required to implement the protocols and in order to identify what data are essential to move forward. And this is highlighted by yesterday's hearing at Congress, hosted by Representative Bill Pascrell from New Jersey, who wanted to discuss what are the issues with domestic violence and traumatic brain injury. And they said we need more money and we need studies. Well, we've put in a lot of sweat equity to get to this point. We've also secured funding, small bits of funding that have allowed us to get to this point to start tomorrow with this important program on domestic violence. And in the end, we're going to be able to understand the scope by which individuals and victims of domestic violence are suffering from these traumatic brain injury signs and symptoms, as well as determine which tools are useful in the diagnosis, which strategies are useful for rehabilitation, and then be able to report and extend those results to other municipalities and states and around the country. And so with that, Hillary Weinberg will tell us about the Maricopa County role.
All right. Good morning. My name is Hillary Weinberg. I'm one of the Family Violence Bureau Chiefs at the Maricopa County Attorney's Office. And a little while ago, Sergeant Higbee mentioned some of the Mesa numbers. I'd like to give you some numbers from more of a county perspective. Last year, the Maricopa County Attorney's Office saw more than 1,400 submittals that involve family violence, and a great deal of those related to intimate partner violence, which is the type of cases that we're talking about in this case, where somebody may sustain a concussion or some type of traumatic brain injury. Years ago, after numerous studies kind of highlighted the lethality of strangulation, we actually changed our law in Arizona to make that particular conduct a felony, whereas it used to be a misdemeanor. And the research and change to that law revolutionized how those cases are prosecuted. We can see the information that we gather from the traumatic brain injury studies going in the exact same direction. Victims in our cases may not remember a lot of details or things about their attack, and sometimes this lack of memory is used to convince juries that they may be not telling the truth about things. However, we really think that this lack of memory or the lack of details could be a symptom of a concussion, and that's why this study is so important on the back end for us. Our first priority, obviously, is to get better treatment for those victims and get them to people who can actually help them with their traumatic brain injuries and help them get their lives back, basically. But on the back end, at some point in the future, we're looking to assess the information that we have and see if the laws that we have in Arizona are sufficient to cover traumatic brain injury. And by the end of the study, we can basically see if the criminal statutes that we have capture the conduct with these types of cases and the types of injuries that the nurses are seeing over and over again. We're very excited to be partnering with the Cactus Foundation, Honor Health, and the Mesa Police Department, and we're very grateful for their work on this project. And with that, I'll turn it over to Dr. Hirsch-Hanmaker.
Good morning. I'm Hirsch Handmaker. I'm the chairman and CEO of the Cactus Foundation. When the county attorney's office heard of some of the work we were doing at a shelter dealing with women and children who'd sustained a head injury, they approached us and said, what can you do to help us along the lines that Hillary just mentioned? We, of course, went back and looked at the literature to try and determine what was known about the issue of concussions in traumatic brain injury in domestic violence victims, and we were really surprised to learn that there were lots of articles calling attention to the fact that this occurred, but there was no data. There was no outcomes, there were no scientific evidence of the numbers. The frequency has ranged from 50 to 90% of domestic violence victims have sustained a head injury, which is pretty astonishing when you put it into a context. That might be as many as 20 million victims a year sustaining a concussion in the United States. Worse than that, we found that there were no programs addressing what to do once you knew who had sustained a concussion and which victims had actually sustained a head injury. There were very few programs even addressing what do you do next after they appear at the forensics lab or after they appear at a shelter. What do you do to return them to society? Through this remarkable relationship that built over the last year with the Mesa Police Department and with the Maricopa County Attorney's Office and the Forensics Lab at Honor Health, we set forth to do something to look at the specific signs and symptoms of the concussion. When I give talks about concussions in athletes, we say if you've seen one concussion, you've seen one concussion. There are no two concussion signs and symptoms that are exactly the same in the victims or the person who sustains the concussion. Therefore, it's really important to not just ask, were you hit in the head? Are you dizzy? Did you black out? There are certain signs and symptoms that are very important to address. The first one, as Sergeant Higbee described, is an inability to converge or to have what we call near-point convergence, and that's what this device measures, and that's what the police officers will do at the point of incident. No one has ever even attempted to do that at the site when the first call is made, to determine whether that simple test could be done, which takes less than a minute, to screen. Once that examination is done and the victim is taken by an advocate or the police department to the forensics lab, we've worked with and are training the nurses at the forensic lab to do a series of 4 tests basically to evaluate the ability of the victim to see properly. Do they have balance issues? Do they have eye-hand coordination issues? And do they have cognitive or emotional issues? Once we do that, the most important part of this study is first to get the frequency. How common is it to draw attention to the problem? But maybe the more important issue then is what do you do to help the victim return to society? If they have photophobia, if they have double vision, if they have balance problems, how do they go to a supermarket? How do they take care of their kids? How do they do job interviews? So what we call return to society is the ultimate goal. We're hoping that by pointing out to these victims, you have these signs and symptoms. They're not just your social issue with the abuser. They're not just your inadequacy as a mother or a father. They are physical findings, and we can treat those. And the hope is we can then show them the objective findings, direct them to the right therapy, get them taken care of, and then break the cycle of domestic violence by letting them find independence in their lives and return to society in a more effective way. I also, before I close, want to mention that we're very fortunate in that those devices that we talked about have been provided to the Mesa Police Department by the Hickey Family Foundation grant, which was very generous. And Honor Health and their foundation has provided us with the equipment that we needed to put in the forensics lab. We could not do this without the support of all these groups. It's been one of the most remarkable experiences in my career to sit around a table with 7 different institutions, and every time we have a meeting, the next question is, what do we do next? It's not, oh my gosh, I have to do what? It is, what do we do next? So we're hoping that early in November, the project will start, and we're very excited about it. Amanda?
And due to the mic situation, everybody will be available for one-on-ones. And there is also, for B-roll purposes, the lab and some different things that we can do for you guys. Just a quick takeaways to recap. Obviously, we're trying to figure out the frequency that we're seeing concussions in DV victims, but the other thing is, of course, increasing that care that victims receive and making sure that they are taken care of, that any issues that they're finding because of this analysis, we're getting them the help that they need. The rollout is in November. It'll go for about a year. Once we start looking at that data as it comes in, that's when we can start looking at those legislative changes if there's any. All right, so any questions, comments, concerns? You're more than welcome to do one-on-ones with any of our speakers, and those that are interested in the B-roll, let us know. We'll take it away.
Who can tell us more about how the device works? If you want to get with our lovely sergeant here, he was one that was helping to train Mesa PDs, folks that are going to be out in the field actually using them, and he can demonstrate how it works.
Mark, do your thing.
And another B-roll activity for you. You guys just let us know what works best for you. I don't know if him sitting at the table right there next to everybody is your best video option, or if you'd like him to do it somewhere else.
Well, we're streaming right now, so perhaps move the bikes down there for our people that are online right now. That'd be a good idea.
Get out of the way, Darren.
Why don't you step forward and he'll do the test on you, and you can.
I would love
And then
that.
we'll just say that that's
Yeah.
going to be repeated
Absolutely.
once they get to us as well. Like that test will be repeated.
I actually have to do it and look competent.
Yeah, all right.
Okay, so this device and the science and such behind it, that's not my area that I'd be even remotely able to answer. Sorry. But the idea is there's 4 different readings. So after you get consent from the victim who will be doing this test, you hold it up, you punch in some numbers just to identify who that victim is, and instruct the victim to, there's an X that's on here. You may not be able to see it, there's an X in there. And the first point of testing is that you instruct the victim to focus on that X, and as you move the device towards them, advise us when that X kind of splits, when their vision sees that the X split. And when they advise you of that, that's the first point of data. The second point of data is to tell them when that X goes back into focus. The third one will be to focus on these lines up at the top. There's a bunch of letters. When that becomes blurry to them, and then the same thing on the back motion is when those lines come back into focus. So it'll be something similar to this. Tell me when focus your eyes on the X, and tell me when the X splits into 2.
The one in the
big X right in the middle.
that's just written
Yep,
there.
right
Okay.
in the middle.
All right. I don't see it's okay. Yes,
So
it's
the
really
focus, if you
close up.
focus, yeah. So depending on.
That's good.
That's good.
Okay,
Yeah.
and then tell me when the X comes back together.
There.
Okay, and then now you advise the victim, focus on the top row of letters and when it becomes blurry.
Okay. Blurry now.
And then tell me when it becomes back in focus.
Back in focus.
Okay, and it's as simple as that.
The significance of that is.
Microphone's
Oh. Well, what are these two, what is that?
Those are the infrared sensors that are measuring, and that they're putting the data into the device. The simple part of this test is between.
Doctor, can you just
Yeah.
go stand right next to the sergeant there?
There you go.
So these tests also, I just want to add, are going to be repeated by, if we have our patients that come and that consent to be in this study, all the tests that Sergeant Higbee just went through are also going to be performed by the forensic nurse examiner, just so they have a baseline reading initially when the officers respond on the field, and then once we get consent from the patient, the same tests will be performed during the medical forensic exam.
The measurement that he was doing is called near point convergence. Between the ages of 6 and 40, it is normal that be around 6 centimeters, and doesn't vary with age until over 40. So in the populations we're looking at largely, if it's more than 6 centimeters, and in concussion patients there's adequate literature, there's a lot of literature about concussions and near point convergence. 70% or more of patients who have a concussion will have an abnormal near point convergence, and that could be as much as 20 to 30 centimeters. So you can imagine then if they can't get their eyes to see one object, reading and functioning is severely impaired. And then that near point of accommodation is the recovery from that. So it's something that's very well understood in the literature with concussions. And the beauty of one of the Cactus Foundation members who invented this device found that measuring, most people do it with a ruler or with a tape measure, but then it's a manual entry and it's very variable. This makes it a very precise measurement, and it'll download from the device to the Surface Pro or a laptop that the officer is carrying with them, so it'll be recorded there.
Yeah.
Does it have a name, doctor, that device?
Concuverge, or concussion quantitative versions.
So did it make sense what those two eyeball-looking things were?
Yeah, they look like little
Yeah.
speakers, because
Yeah.
they've got kind of a.
So it's actually measuring that distance
are the
from your
sensors.
face. Yeah.
Oh, okay.
So just a simple device that will be accessible to all of the patrol units throughout the whole city.
All right, guys, thank you.
Okay.
Question for Amber, is that?
Aaron.
Aaron. Or Aaron?
You can call me Amber, it's fine.
We talked about, I don't know, if compliance is the right word, participation, I guess.
Consent might be the word.
Consent,
Mhm.
when it comes to, a person who's been in a domestic violence situation, sometimes the last thing they want to do is start, providing all kinds of information that might, keep them in the process longer than they want to be. They kind of want to get this over with. I just want to go on with my
Sure.
life. What do you tell the, participants or possible subjects to this?
So we thought about that from the beginning. During our initial planning stages, we thought about, a lot of these patients are on time constraints, especially for domestic violence. Some of our patients are literally sneaking away to see us during their lunch hour, or come in and say, I have 45 minutes to give you, and that's it, and after that, I'm out of here. So we took into consideration, obviously we want to be courteous of our patients' time. All the tests and all the screening tools that we're doing are only going to add about 15 minutes to the exam process. And that's if the patient signs the consent form. It's, this participating in the study is going to be voluntary. They don't have to, just as any medical forensic exam, they don't have to do the exam. So everything is done before the patient or after the patient gives consent. So we did take into consideration time constraints because people have other things going on in their lives that they have to take care of. So looking at all of that, we've narrowed it down to what are the most important tests that we can do that will give us the most data while being accurate and being time efficient, and we're looking at adding only about 15 minutes extra to the exam process.
And what about the emotional part of that?
That just comes with what we do daily. I mean, that's what we do every day, is take care of interpersonal violence. These are trauma patients. Their stories don't go in order. It doesn't make sense. But I will tell you that it's not typically how it's portrayed in media and on TV, where everybody is hysterical and sobbing and, completely emotionally unstable. Most of our patients are calm and cooperative. And we have specialized training to just kind of make an uncomfortable thing. We're not seeing people because they're having a good day by any means. So our group of nurses is especially trained to know how to deal with that, with the compassionate side, as well as being able to take care of them medically. And then if they choose to be able to participate in something that's going to open the door for them to have access to specialists that can help them, return to normal, so to speak, if they've sustained a traumatic brain injury. So.
I'm going to step in and add a few things, and it has to do primarily with the patrol officers. And so very early on, Sergeant Higbee told us, you can't just give me something and tell me to do it, because there'll be a lot of resistance from the patrol officers in adding more paperwork, more time, more duty on top of an already overburdened schedule. And so what he pushed us to do was to simplify the test, explain why the test was necessary, even the science behind it and the evidence for it, so that when all the patrol officers are using the ConcuVerge device, they can then understand that they're part of a process. And then that moved forward to the Honor Health facility as well, where we've spoken extensively with Erin and her partner Jill and all the other nurses to educate about what concussion is, why concussion exists, how we can diagnose it, what we can do to treat it, so that everybody has a particular role in the process. And that follows forward onto social workers and case managers. It follows forward onto the rehabilitation docs and the other downstream therapists that are going to be involved. And then even with Hillary Weinberg, the Maricopa County Attorney's Office, we also went in and educated them about concussion so they could understand the scope, the impact, and the potential consequences behind it. What that now does is at every point of contact with the victim, the person that they're dealing with is able to support them, is able to explain to them why they are undergoing these tests, what the importance is, and whether or not or to what extent we're able to provide that help to alleviate those signs and symptoms. And so the goal is active listening with that victim, understanding where they're coming from, and putting them on a path towards recovery.
Jonathan, is this the first time research like this has been conducted, or do you have precedent?
To the best of our knowledge, this is the first time this type of research has been done. So what other research has been done? There have been catalogs of domestic violence patients and incidents or signs and symptoms of head injury in people coming in through the emergency room or being referred to a concussion clinic. And there's a great paper out of Barrow Neurological Institute from last year on this in terms of how many domestic violence patients they were able to look at and treat. But that is capturing a subset and a very a biased population. We wanted to start at the point of incidence with those initial domestic violence and domestic violence calls. And we don't know of any other entity in the country that is trying to capture individuals at that level. To extend that a little bit further, we are making the assumption that if a call is being made, that it's likely you're going to have one or more signs of head injury. And it could be a recent head injury, and it could be a remote head injury, it could be one head injury, it could be multiple head injuries. We don't know. But we don't want to miss anybody, because the consequences of missing a diagnosis means that somebody's going to be living with headaches, insomnia, depression, anxiety, cognitive issues. And we would rather say, let's be cautious and let's run another diagnostic test and put you on the right path forward. You want the mics? All right.
Cool. Thank you.
Thank you.
Which groups would like to go to the left?